You're listening to the Information Service. The Information Service for documentaries and other information. COVID-19, It Never Went Anywhere. Part 1. 26th of August, 2023. What if I told you that mask mandates may return? The coronavirus designate year 2019, also known as COVID-19 and SARS-CoV-2, was said to have started in China on December of 2019. It was said that it originated from a wet market in Wuhan, and possibly from a bat, or maybe a pangolin, or was it a rat? To this day, and after a time, experts were placing the blame on all possible animals. Said experts have yet to identify the proposed animal source or even the sources. There has also been numerous investigations into the origins of the virus, with many saying that it came from a lab, to a report from the World Health Organization stating that the virus was in circulation around the globe as early as September of 2019. There were several people that were diagnosed with a mystery pneumonia-like illness in places such as New York City, Columbus, Ohio, and in Italy. The first 4 cases of COVID-19 were reported by the China Health Authority around the 20th of December 2019. By the 20th of January, that number increased to 170 patients dying out of a total of 7,111 confirmed patients. By the 8th of March, the virus caused lockdowns to be put in place in various regions of Italy and a complete shutdown of the country the very next day. The situation was a dire one, not only for the health emergency, but also economically. Italy makes nearer to $30 billion per year on tourism alone. A lockdown so early in the year could mean that the health of the economy was uncertain. It is now the 22nd of March of 2020, and the Italian Health Ministry reports a death toll upwards of 5,476 people from COVID-19 alone. COVID-19 didn't go anywhere. Part 2. Understandably, world leaders were in a state of panic as the unknown virus was not only wreaking havoc amongst the population, but it also exposed the weakness of healthcare systems around the world. In a few weeks to come, the most expensive healthcare system in the world, the US, will be revealed as being even less prepared than all other Western nations. That is, despite making more money per patient than all other Western countries, the US hospital system will struggle to find the proper supplies needed to treat the sick. And soon, they will turn to burying victims of COVID-19 into mass and unmarked graves. By the 10th of April of 2020, the virus does indeed wreak havoc in the US, and by this time, the health department reports around 467,000 total cases, of which 16,700 people have died. The city of New York have been burying the bodies of the victims in mass graves on Hart Island for some time now. Health officials consider even the remains of victims as severely hazardous, all 7,844 of them. However, news of a breakthrough COVID-19 vaccine has become public knowledge. Also in April of 2020, human clinical trials of the Pfizer-backed BioNTech vaccine was announced. Some areas of society wondered how it was possible for a vaccine to be ready for such an unknown virus so quickly. Scientific experts insisted that vaccines usually take 2 to 5 years to hit the market. This wonder vaccine was just in time, even though no one knew that the vaccine maker, the German firm BioNTech, ever existed. Those who worked on Wall Street, however, were familiar with the firm as it was added to the Nasdaq index in 2019. So now hope was around the corner. However, the World Health Organization Action Committee warned world governments from using the vaccine as the sole answer to the pandemic. As a direct quote, vaccines do not equal to zero COVID, as they said in their committee. The WHO also suggested that the COVID-19 should be only part of the strategy of wearing masks, social distancing, and hand washing. This, they recommend, will result in the zero COVID status. This recommendation, however, will be ignored by all governments. But let's not get too far ahead, as this press conference takes place in late December 2020. In July of 2020, clinical trials began for a second vaccine that was developed by Oxford University for the pharmaceutical giant AstraZeneca. As soon as the emergency use authorization for both vaccines were granted in the US in December of 2020, world governments started the policy of vaccines are the key to stop the virus, because it was to grant immunity to those who took it. The truth is that the vaccine was never designed to stop infection, but only to prevent severe infection, which means that even after taking the vaccine, it is 100% possible of still becoming infected by different strains of the virus. The COVID-19 vaccine was and still is not a cure. However, that never stopped governments from selling it as the cure. Through 2021 and 2022, if one wanted to travel in an aeroplane, attend university, or enter government buildings, they were forced into taking the vaccine as it became a requirement. This despite there being no evidence that the vaccine could prevent infection or the transmission of the virus. During that same time period, governments around the world went back and forth instituting masks and social distancing policies and dropping them based on infection levels. Health officials have made it known that to the public that COVID-19 infections are tracked in two very distinct ways. Hospitalizations track exactly which groups have been infected. However, this method only reveals the number of severe infection cases. The other method is testing wastewater as the virus can live for some time in sewage water through urine and fecal matter. This method gives a greater idea of the levels of infections from people who have either mild, moderate, or severe infection across the entire population. Those with mild and moderate infections tend not to seek medical attention. Elevated levels of COVID-19 in wastewater suggests that the infection rates of all types are increasing in the population. Part 3. By the 11th of May 2023, the COVID-19 global public health emergency had ended, and all of many mask-wearing members of the public celebrated the news. For some, the news was interpreted as the end of COVID-19 and that it was all over with. However, there were some who listened to the whole message. They listened to the warning to remain vigilant as the virus still persisted. By August of 2023, after months of going maskless, there were two potent virus strains in circulation. XBB.1.5, also known as the Kraken, and EG5, also known as Eris. With the news of such potent virus strains, there are many questions on most people's minds, some of which wondered why COVID-19 was still here, even though they were told that it was finished. Others asked, why aren't the vaccines working? And some went further and asked, why do I need to take another vaccine? Inadequate information has been part of the pandemic for some time since the beginning. We have seen doctors being interviewed on television about the vaccines, either saying that vaccines ensured immunity for the user or saying immunity in the same sentence as the word vaccine. To answer the first question, the truth is, when the pandemic public emergency designation was withdrawn by the World Health Organization, the health officials also urged the global community to remain vigilant because COVID-19 was still a threat. The answer to question number 2 is that by and large, the vaccine work as they were designed to. They were only designed to prevent an infection from becoming severe. They were not designed to prevent infection or transmission. For question number 3, it is best left to the individual to decide, because at the moment, vaccines alone do not prevent infection. As recommended by the World Health Organization, vaccines should be used in conjunction with wearing masks, social distancing, and hand washing. Which in fact brings to reason why we are still dealing with COVID-19 for a third year and facing the prospect of a new surge of infections and lockdowns. Very early on, after announcing the release of new vaccines, national health organizations around the world told their populations that masks and social distancing were no longer needed because the vaccines were the only way to defeat the virus, which is exactly the opposite of what the World Health Organization recommended. You have been listening to the Information Service. For more documentaries and information, please like this video and subscribe to this channel.